Welcome back. I'm Dr. Jake Coffman, and today we're going to be discussing the different grades of whiplash injuries. What I mean by that is when a whiplash injury occurs, you can have no symptoms, so a grade 0 whiplash injury, or you can have a grade 4 whiplash injury where there's a fracture or a dislocation, complaints of pain, and possible neurological symptoms. Grading a whiplash injury allows us to provide a consistent framework across different healthcare providers. It helps us to guide the approach to treatment and provides an estimation of recovery time and the risk of developing chronic symptoms. However, this classification system is not the end-all be-all, because there are other factors that play a role in the process of healing and recovery from a whiplash injury. So what are the different grades of a whiplash injury? First, there is level 0, or grade 0. This is when there's no physical signs or dysfunction, no complaints of pain. We then have grade 1, where there's no physical signs of dysfunction, but there is complaints of neck pain or neck tenderness. We then have grade 2, where there's musculoskeletal signs like decreased range of motion or pain with movement, and complaints of neck pain or tenderness. We then have grade 3, which may include neurological signs and symptoms. This could be numbness and tingling, pain radiating down the arm, dizziness or unsteadiness, and then the musculoskeletal signs of pain and discomfort with movement or just being still. And then lastly, we have the most severe, which is grade 4, and this includes fracture or dislocation, usually seen on an X-ray or MRI, complaints of pain, obviously, especially if there's a fracture, and most grade 4 should be seen immediately by a doctor, as these are the most severe whiplash injuries. So we have grade 0 to grade 4, no pain to extreme pain with a fracture or dislocation, and this classification system provides a useful framework. However, symptoms don't always neatly align with these categories. The complexity and variability of whiplash injuries has led us to an evolution in our understanding. We've moved from viewing whiplash solely as a neck injury to recognizing it as a potential disorder with wide-ranging effects. This shift gave rise to us talking about whiplash-associated disorders. So we still categorize whiplash injuries in the 4 grades, but whiplash-associated disorder is that evolution of how we view whiplash injuries. The reason for this is because a whiplash injury can also include symptoms like headaches, dizziness, cognitive difficulties like difficulty concentrating, psychological distress like increased anxiety, and even chronic widespread pain. So in our next video, we'll dive deeper into the concept of whiplash-associated disorders, exploring how this expanded understanding has reshaped our approach to diagnosis, treatment, and prognosis of whiplash injuries.